There we are. And we are live, y'all. Welcome to the BIRTHFIT podcast. This is episode number 241. And this episode, I call it Nervous System Love with Dr. Scherina. But it's going to be all about the nervous system and get into some of the goods and maybe the ups and downs of the nervous system and how we can care for ourselves. And hopefully you'll walk away with a little pearl of wisdom that you can take with you for yourself and or your family. So if y'all don't know Dr. Scherina and y'all don't follow her on Instagram, I feel like the whole world follows you now on Instagram, but they should, because the nervous system is so important, as we'll get into. But go to Instagram, follow her. She puts out great information, and it's strictly nervous system information. So go do that first. And then before we get into anything, tell everybody where you're located and your practice name so they can write that down right now.
Yeah. So I'm in Orlando, Florida. We go by IWC Family Chiropractic. IWC stands for Integrate Wellness Center. Yeah. So we are awesome. In the heart of Orlando, right in almost downtown area. Yeah.
Okay. So welcome officially to the podcast, Dr. Scherina. I would love to jump right in and hear how chiropractic found you, as you say, on social media, and how your story with chiropractic and the nervous system began.
Yeah. So it's not one of those like typical miracle stories that you hear from chiropractic students and doctors that, chiropractic saved my life or, stuff like that. I actually fell into the profession, not knowing anything about chiropractic at all. My story, I'll try and keep it short here. Long story short, I was a pre-med student, did not end up following through with that route. I did apply to medical schools and actually withdrew applications because I didn't feel connected to the professions that I was looking into. And so, of course, went back to school, needed another job, fell into a chiropractic office. And this was with no knowledge whatsoever.
Just a random job.
Just a random, I saw front desk was a job. It was close. And I was like, here we go. This is what I need. Yeah. So I took the job. And then, of course, just watching learning about chiropractic, it just was mind-blowing to me. It was, of course, mind-blowing seeing the doctor actually working with patients hands-on, that was something that it was missing quite a bit from my journey in pre-med, was that hands-on experience with patients. So watching him work with patients and then hearing all of the stories when patients got off tables, that just like blew me away. Everyone was saying a different story, but they were all so grateful and happy and feeling good. And I'm just like, well, what is going on? So yeah,
what is going on that table?
Exactly. So I had to dive deep into what chiropractic was about, and in that journey, of course, if you've ever worked in a chiropractic office, one of the benefits of being there is that you get free care most of the time. So here I am, a college student. Didn't know what chiropractic was about, and then I actually didn't have any symptoms. Like I didn't have any complaints with what's going on with me. Like I was just like, all right, let's just try it. Let's get on the table.
Yeah.
And it was cool. It was awesome. It felt cool. And then I didn't really start to actually feel my body make drastic changes until a few months in. And then at that point, I was like, okay, something's happening here. Like, what's going on? And then it was probably 6 to 7 months later where I finally started to take note that my life was changing. Like everything it was changing, everything about what I wanted, who I was, just everything just started making these really big shifts for me. And I was like, nothing changed except for chiropractic. And so then, of course, that's when I started really like, okay, there's something deeper than just chiropractic of what we all think chiropractic is.
Yeah.
And that's when it was apparent. It just everything, the big picture was the nervous system. And that's when I started diving deeper.
It's I truly feel like, okay, so similar story my story was similar, on the path of med school, and then I felt like chiropractic found me. And
Yeah.
I truly believe, like, when you're open to things like that, like God's calling or the universe directing you, like
Yes.
you'll be ushered, you'll find your path, like it'll light up. So
Totally.
that's freaking cool. Okay,
Yes.
was it a network doc right away?
It was network. So that
Oh,
was
wow.
this. And so, yeah,
So
you know,
explain network for people, because
so yeah, networks.
within chiropractic.
hmm So network spinal is more of a specialty technique that works
Mhm.
directly with the nervous system. So we're not moving bone to influence the nervous system. We're going directly to the nervous system. We're contacting specific points along the spine that are directly connected to the spinal cord that release that tension that gets bound within the spinal cord to allow that. There's like a flow that happens within the. It's a very parasympathetic because we are working directly with those areas of the body.
That's awesome. That's really freaking cool that your first experience was network,
Mhm.
and that's how you got introduced to chiropractic.
It's a crazy it's a crazy story. Like it's yeah, to know because like if you know network, you know it's extremely rare. Like you
Yeah,
know we only have I mean, I have a directory and there's only about 150 doctors on that directory, which seems like a lot, but that's throughout the world. That's very
right.
little compared to traditional chiropractors, right? So the fact
Totally.
that I fell into a network office was insane.
That's
Yeah.
mind-blowing.
Yeah.
Yeah, I've looked for a network doc around the Austin area, and I found 2, but they're
Mhm.
like, ones that are practicing and doing the thing.
Yep.
One's super north, one's super west.
Yep.
So, yeah, it
Yep.
is rare, and I think the one west just went on maternity leave, so she's
Yeah.
out.
Yeah. Yeah. No.
But, and for those of you that, have ever watched Goop, Network was on Goop, Donnie Epstein, and I forget if who was actually on Goop
It was
that
Dr. John Emerald.
okay.
Yep.
Like,
Mhm.
I don't remember if it was him, but yeah, so
Yeah.
there's the connection. Okay, so let's get into the nervous system.
Yeah.
And if you had to describe it to a patient day one, or, um, you know, I would say very street terms, like what is it and why is it so important as far as the nervous system?
Yeah. So I think we lose sight of the fact that the nervous system controls everything we do in life.
Yes.
It's so deep. Like, yes, we have a body, but think of your body as your nervous system. Like that's
Yeah.
how important it is. That's how important it is to take care of it, to maintain it, to tend to it, to love on it. Just like we love on our bodies, our skin, all of that. Like it needs to be known that the nervous system is that's it. Like that's the key. Um, so yeah, it controls, just the smallest things that we wouldn't even think about, the way we communicate with people, the way we connect to people, our relationships, the way we parent. Um,
Yeah.
everything comes through within the nervous system. And, our nervous system is shaped from honestly when we're in the womb.
Yeah.
It goes that far back to how we are shaped as human beings.
Mm.
Yeah.
Mm.
It's so
Okay, so one of the things we say in BirthFit is baby is a hitchhiker on mom's nervous system.
Mhm.
And I shared one of your posts back with you. Like, we got to talk about this one.
Yeah.
And it was specifically talking about mom's nervous system in relation to baby,
Mhm.
and, showing up in things like colic and other kind of like dysregulated symptoms. But
Yeah.
can you talk about that relationship, like the mother baby dyad?
Yeah, for sure. And it's not easy to talk about because I know
No.
there's a lot of sensitivity around it, of course. Like there's never a fault, like no, I never talk about these things to make any moms feel guilty. I have my son, but it needs to be known that our nervous system shapes their nervous system. Like that's where it starts. So if we are, pregnant and completely stressed out with life or don't have a good support system, not eating correctly, not preparing our bodies correctly, it's going to affect our babies. I mean, it's shown scientifically. There's research out
Yeah.
there the babies are affected in the womb. I mean, why did we stop smoking? Why did we stop when we're pregnant? We know that affects our baby. So why is stress hormones any different?
Yeah.
So that needs to be, I think, more talked about. And I know it's like I said, it's a very sensitive subject to talk about because we don't want to, upset mothers even more. Like, we're already stressed out. Well, that's going to stress us out even more at it. But that's the reason why we need to be really, truly taking care of ourselves before we even get right. It's all about preparation right there. But yeah, we start seeing things, when our babies are born. That's why me and you, we both see a lot of expecting moms, and we see the newborn babies, because we see, if we catch those symptoms early on and we start to work with the nervous system earlier on, we know that their bodies are so adaptable at that point.
Yeah.
So it's a beautiful thing to work with them. But yeah, we see symptoms like colic show up. When they get to be toddler age, behavior stuff shows up. Whether or not they're aggressive, but it could be many things, digestive concerns. It could be just developmental. They're not reaching their milestones. They're crawling differently, like they're not eating properly. They're not sleeping well. So many different things could go sideways if their nervous system is dysregulated. And I did mention it starts in the womb, but there's also things like the birthing process, of course. And I always say, like, birth trauma doesn't always seem traumatic, and it doesn't have to be labeled as trauma, but for example, my son, he was tucked into the corner of my pelvis. He wasn't in an ideal position for birth, and my midwife said that. So I had to do a lot of, spinning baby stuff to really get his position. And he eventually did, but like when he was born, like he was in that position for the final 6 weeks of my pregnancy. And so when he was born, he wasn't nursing on one side. And how could you deny the correlation there? There's an absolute
similar to her. She preferred a side.
Yeah, absolutely. Absolutely. And so, I mean, thankfully, I have the knowledge that I have. I am a chiropractor, so I adjusted him right away. But if I didn't, and I didn't know these things, we just continue to, like they're
it's like a compounding effect.
Absolutely. And their stress continues to build within their body. They get frustrated because they can't eat. Mom gets frustrated and tired because she doesn't know what's going on, right? So it's just this ripple effect that can throughout their lives.
Yeah, those early days, that first 3 months can have such an impact, like you just explained, on their health and the trajectory of their life.
Yes.
For the rest of their life, like just that example you said, like, okay, it wasn't capital T trauma, but he had a preferred position, came out, preferred one side because it was more comfortable to him, and his body's doing the best he can for survival.
Exactly.
But unless you free up, release any subluxations, then it's just going to go from there. It's probably going to go, it might get diagnosed as a tongue tie in another scenario and go down the laser route when it could have been a simple fix,
right.
Or a simple adjustment, I should say.
Yeah. And then, I mean, you and I both know that colic can turn later on, what we call the perfect storm, right? That colic to milestones being delayed, and that can turn into behavioral issues, and that can turn into ADHD, and that can turn into anxiety. Like, it just
totally
to go and go if we're not addressing the body.
Yeah. It's wild and like, I like how you said earlier, you're like, this is not to put the blame or shame anybody, like, because these are hard decisions. And, what made me aware was looking back on my own life and realizing, oh, okay, my mom did the best she could with what she had. Absolutely. But now we know better, so we're going to do better in this next generation, and the way her grandkid is raised, and it's been really eye-opening for my mom, her grandma, to witness and learn some of these things. But we do the best we can with what we have, and our bodies are doing the best it can in that situation.
Yeah, we just need to be grateful that we're evolving. Like, we need to be grateful that we're learning these things. We have these resources and tools available to us. Yeah.
Yeah, totally.
Yeah.
Oh, okay. So there's a few posts that I've loved, and I'm like, I want to reshare everything.
Yeah.
But you talk about healing, and one thing we talk about in BirthFit is, we explore the range of motion of our nervous system.
Yeah.
And you talk about this a lot, and healing has to be in a safe place, and it doesn't always have to be challenging that external border of your nervous system. So yeah, can you talk on healing and maybe just some simple healing things that people could do at home to support their nervous system?
Yeah. Safety is really big. There's a lot of times where, there's so much out there with the nervous system. Again, being grateful, but really, really honestly, like it should be simple. It shouldn't be that you have to go to this like 3-day retreat to reset your nervous system and you have to do all these things every single day, like a laundry list of things to reset your nervous system. That's going to stress us out, right? That's like pushing us to our capacity there. But it needs to be to back down to like simple lifestyle habits that create that safety. And again, safety is important. So you can't really heal when you don't feel safe. Like our nervous systems they're wired for survival. So if you don't feel safe, like that's when your nervous system is going to go into that stress state. So you can't be in both at the same time, right? You can't be in growth and yeah, we all know that. Yeah, so it's the simple daily habits that I would say are key. You have to start to listen to your body when you are around certain people. Do you feel safe around them? Do you feel triggered around them? Do you feel, uncomfortable around them? That creates an environment of safety within you. Of course, we all know what we put in our body creates safety too. Is it inflammatory? Is it not inflammatory? Those are important aspects there. But like, yes, you can calm yourself down. You can do some breathing techniques. You can read a book. Of course, those are going to be great, but those shouldn't be like, I don't think that, you need to set aside 5 hours per day to be doing all of these mindful activities. It's going to be what you do every single day that you incorporate into your life to create that safety for your body to really get into that parasympathetic state to heal.
Yeah, and I think that's you, like you said, keep it simple. Like it doesn't need to be 5 hours, because moms listening to this, especially new moms in their first year, they don't have time for that kind of. They're not going on a retreat.
Yep.
So
one of the big things that I see, like at least the comments that I receive, is just everyone just getting so frustrated. Like there's so much information about healing out there. There's so much information about what to do, but no one tells you exactly what to do. And that's just because there's no exact answer for everyone. And if you've been in this cycle of stuckness for years, chronically, and you still can't get out of it, you're practicing all the mindful things, you're doing all the breathing, like it's probably time that you see a practitioner. And I hesitate saying that because everyone's like, oh, like there's so many other people selling things with nervous system. And of course, like if anyone's offering you a 3-day reset, like don't do it. Like you cannot reset your nervous system in 3 days, right?
No, it's going to take frequency 6 months, 12 months.
Yeah. But yeah, if you've been in this cycle of stuckness for a long time, like please don't hesitate to ask, like to get help with someone that's actually working with directly with the nervous system. I say this all the time. We can breathe our way into calmness. We can read about the nervous system, but is it actually touching the nervous system? Yeah.
That's good.
Yeah.
And yeah, absolutely. We do need to reach out. I had different coaches for different parts of my pregnancy, my preconception journey. She found her voice. We definitely need to have those trusted sources in our back pocket, and yeah, if you're stuck, like find a nervous system chiro, go find somebody on your directory or PX docs, or ask a friend, like somebody you trust.
Right.
Because that's going to help move the needle, you
Totally.
know. Oh my
Totally.
gosh.
Absolutely.
So, okay, yes, you mentioned touch and the power of touch. Talk
Mhm.
about that a little bit.
Yeah. Like I said, there's just so much endless information there about how you feel and and yes, I talk about those same things, like being mindful of your relationships, knowing who triggers you, where you feel good, where you feel comfortable, where you feel safe. That's a piece of the puzzle. But in my opinion, like your body keep your it's everyone knows this book, your body keeps the score. Like your body holds on to that trauma. Your body will tell you if it feels safe or not. I mean, doing these repetitive exercises over and over and over in time, yes, will make a shift, but the biggest shift comes from actually working on the body, touching and working directly with the nervous system. I just think it's so missed. Like in my opinion, I just don't understand how you can heal the nervous system without working with the nervous system.
Yeah, it's
Yeah.
and chiropractors have been doing it for years.
Oh my gosh. Yes, it's there's that big joke going around that all this nervous system talk is going on, but hey, we've been working with the nervous system for over 100.
Yeah,
Now everyone's just like, oh wait, chiropractic does that?
yeah. Hello, we're here.
Yeah, exactly.
That's awesome. So,
Yeah.
okay, let's talk a little bit about safety and birth. What are some conversations, or how do you have the conversation with a mom that comes into your practice and maybe she's trying to decide where to give birth or who to hire as her provider, whether it be an OB or a midwife, or even go like the free birth route?
Yep.
What are some conversations? Whoa, you were standing up. Sorry, y'all, beers in the background.
Oh.
Yeah, what are some like examples of conversations that you have, and how do you help women decide or
Yeah.
facilitate that?
So the first question we always ask if they do come in, they're pregnant and they have questions about what to do. The first question we ask is, what do you want? Like, how do you want to birth? What is the way you see yourself birthing? And if they still don't know, or they say something like, hey, this is my second child and I did it this way the first time, I kind of want to do it differently this time. I ask them always, what do they envision? Do they envision having birth in a hospital? Do they envision having birth at home with a little face? But
Really?
yeah, it's all about, making sure they have what they need and want, and then providing resources. We have a whole laundry list of resources in our office whether it's books or whether it's other practitioners. So we have contacts for midwives, contacts for OBs, contacts for all the doulas, everyone. If you want a free birth, we have a contact for that. So just really empowering them with all of the knowledge possible so that they can make their best decisions. That would be like probably the bulk of the conversation of how,
Yeah,
yeah, how it moves in our office.
awesome.
Yeah.
And then postpartum,
Mhm.
how do you help or encourage the facilitation of like that integration or the slowdown of the first month,
Mhm.
as mom and baby are, so new?
Yeah.
Even if it's mom's fifth baby, that relationship is, so
So
fresh, so tender.
right. Yeah. We stress so much how important care is postpartum. And that's just because, I actually just posted about this yesterday, but like we get into just being a new mom, whether you said like it's our first baby or whether it's our fourth baby, I feel like we get into this, just this rhythm of almost isolation with our newborn baby. Like we don't, and that's okay to do when you're postpartum, because that does help us slow down. But I can't stress enough how important it is to continue to care for you as a mom, in those postpartum days. Like I said, your nervous system is going to shape your child's nervous system. So if you are stressed out, whether you're doing it alone, whether you don't have as much support as you need, caring for yourself in those days is crucial, almost as crucial as, your prenatal days. So yeah,
Absolutely.
yeah.
Yeah. I'm glad you touched on that isolation piece because it is easy to isolate yourself. And I became hyper aware of that. I was aware of it working in BIRTHFIT for like 10 years before,
Yeah.
but like when I was actually in it and I was doing my 30 days of lying in, I was like, oh, I could easily lock myself off from the world and never go back out there again.
Yes.
Um, but I
It's
had
like,
to like force myself to get out.
yeah, it's one of those stages of healing. I wouldn't even call it a stage, but it's just like, it's part of that healing process that we can get so deep into, whether it's physical healing or emotional. Because I mean,
Yeah,
with the birthing process, it's mostly physical healing at that point. Like we're trying to physically
right.
heal our bodies, but we still want to dive into that deep isolation, which I mean, it's okay to you have to find that balance within that isolation period because you need the support. You need your tribe. You need the community. You need to care for yourself. So you need help, Yeah.
Totally. Um, Thinking about the nervous system and postpartum, do you think, and this is just a random question, but or no, let's talk about birth first. So how much of an impact do you think the nervous system has on a woman's birth and her birth experience?
Well, in my experience, I know it is key.
Yeah.
In my own experience, like I know if I didn't have the care that I had going through birth, I wouldn't have had like I wouldn't
Mm,
it wasn't just my body, it was my confidence, it was
yeah.
just my mindset going into birth. It was everything. It was just the big picture of everything of working with my own nervous system the entire my entire time in chiropractic college, leading up to my birth. So I had a ton of care, but it was everything. And then I see it every day in practice where
Yeah.
I have moms come to me when they didn't receive chiropractic care their first pregnancy, but they definitely want to their second pregnancy, and it's a world of a difference. It's
Yeah.
always a world of
Night and day.
yeah, it's night and day. They're like, I can't believe I didn't do this for my first one. Birth was easier, birth was simple. Like they're in there, like they're calling us the same day. They're like, when can I come in? You know,
Yeah.
it's crazy the amount of difference that
Yeah.
with the body and the nervous system makes to give
I
birth.
would totally agree. Like comparing clients, like when they talk about their first and second,
Yeah.
um, it's almost like they've like trusted their body. Like they feel more at home. They've developed a trust,
Mhm.
and now they trust the whole birth process.
Yeah.
Which
Yeah.
is super cool.
Trusting your body is you cannot heal if you do not trust your body. Like
Ooh,
you cannot move through processes without like that's imagine dealing with a chronic illness and not trusting your body. Like how are you supposed to heal from that? You have to have that trust. Is trust and safety. Those are like my two key words in life is trust and safety. So you have to have that within yourself in order to give that to. Yeah.
those are good words.
Yeah.
They're powerful.
So
And
powerful.
I'll add like it's different than like a belief. Like you can say I believe in something, but I
Mhm.
believe in God. But when you trust, like you act differently.
Totally different. They're two totally different things for sure.
Yeah.
Yes.
Okay. Okay. So then postpartum, because we just went through this huge birth experience where it tested our limits on everything.
Yeah.
How like what is your opinion on like how long it takes to truly heal? And if you include like emotions, the nervous system, yes, the physical aspect of it, because we're talking about that, third initially, yes, physical, like heal the physical.
Yeah. Oh,
Yeah.
feel like it's so different for everyone, but I do think it takes it takes a lot longer than we think it takes.
Yeah.
I believe it takes longer, especially if you're talking emotionally, physically, like it does. I mean, I think that physically we can get back into our bodies pretty quickly, you know.
Yeah.
We can start to move our bodies and get back in shape and tone up. But there's always the mental process that comes with caring for a newborn.
Yeah.
And tending to ourselves. We tend to, again, kind of slip away from that, and again, that's expected
Yeah.
because we're moms and we have this little tiny human to take care of.
Yeah. We put their needs above ours.
Absolutely. So I think it's completely different. And if you have, I feel like, gosh, if we birthed like we birthed many years ago,
Yeah.
this was quicker. We had our tribe, we had our community, we had resources, we had people, we had caretakers, we had our neighbors that would come over
Yeah.
and help us, like all of that plays a huge factor in our healing. And
Yeah.
today we really don't have that. I mean,
Totally.
we have the timeline, first of all, of when we're going to be going back to work. That already is us out, so it's like, that's, in my opinion, that's what prolongs our healing process when it comes to
Oh,
our mental
yeah.
health, for sure. Physically too. I mean, I had a very long healing journey postpartum, very long. Like
Well,
my yeah.
like physical or emotional or all of it? All of it. Okay.
Mine was long, and that's because I'm a business owner.
Yeah.
Yeah, so it was that I did go through a divorce. Like, there's so many different factors there for me. So yeah,
Yeah.
yeah, it was a long time.
Dang.
Mm.
It's interesting you say that because I was, I made sure I was like, okay, I'm taking 3 months off work.
Mhm.
I'm doing a line-in period. And just within the last, I would say, month or so, probably month, not even more, I start to feel like myself again.
Yeah.
And that's 9 months, that, and I wouldn't even say I'm healed. Like I'm still not, if like for the fitness geeks out there, like I'm definitely not lifting or working out like I was before,
Right.
but I'm working out again. I'm training, but it's 9 months later and I'm like, okay, I'm
Yeah.
starting to feel like my old self or
Yeah.
like resemble my old self.
Right.
But I do think there's some validity in there's research out there that's like it takes 2 years or 3 years, but like you said, it depends on everything else that's going on in life too.
Right. I think,
Yeah.
yeah, like I said, I think physically we heal a little bit quicker than we do
Yeah.
emotionally. We tend to put
Yeah.
it, well, I mean, everyone in general, whether you're a mom or a dad or anyone, I mean, we tend to put our emotional needs last, right?
Oh, for
That's
sure.
conditioned to do.
Yeah.
So that's a huge piece of the puzzle. For
Yeah. And then those dang emotions are stored in our body.
Yep.
They're stored in our body until we complete that nervous system cycle.
Exactly.
Okay. Well, if there's three things, let's do three things. That somebody could take away today to support their nervous system, what would you tell them or encourage them to do?
3 things to support your nervous system.
Yeah, I know.
Thing is always going to be chiropractic.
I
Yes,
love that you said that first.
it's going to be the first thing. Yes, I'm biased. I'm a chiropractor, but the way we work with the body is just so, it's one of a kind. It's so incredible. Like there's
Yeah,
no
there's no other profession that does it.
profession that does what we can do,
Yeah,
and I'm not saying you need to depend on chiropractors, but again, being in that cycle of stuckness, like a chiropractor, we know how to work with the nervous system. So that's hands down always going to be my first
love it.
piece of advice. The other big thing that I would say to look out for, and it's probably one of the hardest things, is to be mindful of the relationships you invite into your life.
Ooh, that's good.
Yeah, they play a huge part into our regulation or dysregulation.
Yeah,
Co-regulation is huge, where people
yeah.
that naturally want to connect to people, and that's a beautiful thing. But if we're connecting with the wrong people, it can easily send us into dysregulation where we won't even be aware of it. And then
Yeah.
creates this chaotic environment. And then guess what? We're used to the chaos, and that's what we continue
Yeah.
to use over and over and over again. So I would say that's probably one of the most hidden aspects of really truly finding a healing journey.
Yeah.
The right find your people.
Right. And
Yeah.
it's like, I think you posted this a while back, but it's like, if that calm or that peace doesn't feel normal, it's going to feel strange, and that's not going to feel like healing or
Mhm.
new, or it's your nervous system is going to be so used to the dysregulation.
Absolutely. It's so funny. It's not funny, but it's interesting to experience it. I mean, I've experienced this myself too. When you find like an actually like a safe relationship, those
Yeah.
relationships are actually boring.
Yeah.
Feels boring because there
Yeah.
isn't so much like back and forth or inconsistency, which makes you feel there's none of that. So it actually
Yeah.
can feel like you coast, and it's kind of boring, and it's like, wait a second,
Yeah.
what are we doing here? I mean, of course
Yeah.
it's fun, like you go on dates and stuff, but like, yeah, those relationships, like they can feel a little bit boring because it's safe. Yeah.
Totally. Yeah, been there.
Yeah.
Experienced the chaos of one relationship, and then you're like, wow, this is cool.
Yeah.
You have to, like, I've had to settle myself down and be like, okay, I don't have to be on guard. Like, this is
Oh,
cool.
exactly.
All right,
Um,
do you have a third thing?
yeah, my third thing is always going to be to get out of our heads and into our bodies.
Oh, yes.
Yep.
Yes.
So we always forget to. I mean, it's a lost art to listen to our
Yeah.
bodies, right? When we're eating foods and we don't really hear what our body likes and dislikes anymore. We don't know how to do that anymore. And I think it's really a lost art. So getting out of our heads and back into what our body is feeling all the time is really going to
Yeah.
help with nervous system health.
Take those pauses and check in.
Absolutely. Yeah.
Ooh. Well,
Yeah.
this has been amazing.
Yes.
Thank you.
Yeah, you're
Thanks for
so
hanging out with me and Vera.
so happy I got to see your little face for the first time.
Yeah, you little stinker. She's like, we're done, Mom. No. All right, remind people where they can find you on social, if you have a website you want them to visit, contact info, all that good stuff.
Yeah, so you can follow me, Dr. Scherina, Schina. My practice is in Orlando. I have my website up on my Instagram page as well, drscherina.com. If you're looking for nervous system chiropractors, I have both directories. So I have my own directory of network spinal doctors and then a directory of PX docs, which you are one. So yeah, I think those are the two best directories out there to find nervous system practitioners. But yeah, and I'm in Orlando, Florida.
Awesome. Thank you so much. And y'all, by the way, I didn't even say this in the beginning. Dr. Scherina has the best hair. The
I never
best.
had a conversation without one comment.
Yeah.
Thank
Like,
you.
I tell my husband, I'm like, if you grow out your hair, it's going to look like her. And I try to
Yeah.
get him to grow. She's got perfect ringlets, but it's amazing.
Thank you so much.
All right. Enjoy your day. Enjoy your weekend. And we'll talk soon.
Okay. Bye.
Bye.